Hey everyone, welcome back to another episode of the Brawn Body Health and Fitness Podcast. I'm super excited for this episode today about a topic that I am notoriously bad at: golf. I'm joined by Dr. Noel Wagner to be discussing golf, physical therapy, and performance today. Noel is a board certified specialist in orthopedic PT, and he's also an active duty Navy physical therapist. He owns his own company, Driven Physical Therapy, in Jacksonville, Florida, where he focuses a lot about the injury management, treatment, and performance enhancement of athletes and golfers especially. So I think you're going to love this episode today. Enjoy the show. Noel, welcome to the podcast. I'm super excited to be working with you today, buddy.
Thanks for having me, Dan. I'm excited to dive into some topics this evening and discuss further some of the things that I like to see and enjoy working with my clients.
Yeah, definitely. So, for people who aren't familiar with you or your private practice company and all the amazing things that you're doing in the world of golf and physical therapy, would you mind kind of filling them in a little bit about yourself, who you are, and what you do?
Absolutely. So I'm originally from Nebraska, went to University of Nebraska Lincoln for undergrad, go Big Red, and then went to Creighton University for physical therapy school. So go Blue Jays. After physical therapy school, worked at outpatient private practice for a while. Saw your generic outpatient population anywhere from pediatric to geriatric and everything in between. Post-op, sports injuries, total knees, total hip replacements, all that good stuff. From there, I applied for what's called the direct accession into the United States Navy and was accepted as a physical therapist in the Navy and have been doing that for 2 years. So, one of the things I'll mention, being in the Navy is the views and opinions expressed tonight are mine and mine alone. They do not necessarily express the opinions of the Department of Defense, Defense Health Agency, and the Department of the Navy. Always got to get that out of the way, right? So, but it's cool. They we'll like I said, we'll go dive into kind of what I do with private practice, and it's kind of a mobile cash based private practice, but doing it as a side, right? So my full-time job is active duty military physical therapist, and the Department of the Navy is gracious enough to allow their sailors to do what's called off-duty employment. And I've decided to dive into the world of private practice, opened up a mobile clinic with a few areas of interest and specialties, one of them being golf rehabilitation, focusing on that specific demographic and type of client.
Yeah, that's amazing. And thank you for your service, by the way, Noel.
Thank
So
you for the support.
what got you into the golf realm? Are you an avid golfer yourself, or?
I am avid. Sure, that's a good term. We'll call that. I was never I was never a professional golfer by any means, never amateur, never scratch golfer, right? It's one of those areas that I really just have always had an interest in. In the activity itself, I enjoy golfing. I enjoy the sport itself. But also diving into the biomechanics of it, right? I think when we're going through physical therapy school, or even before that, what gets us into physical therapy rehabilitation is our interest in the human body, how it moves. And the golf swing is such a unique process, sequencing of movements, and it looks so easy and it's so quick, but there's so much that goes into it. The world of golf, there you can get deep into the weeds of the details as far as the swing itself, the golf course, maintenance, the mindset when it comes to golf, and we're talking, more professional, elite level. And so with my clients, I treat anywhere from just your average golfer who maybe is just getting into it, has been golfing for a while. Maybe they're a retiree who has been golfing their entire life. Now they're making more time for it. And they're maybe having some mobility issues, maybe some aches and pains, chronic issues. And then also I see up to collegiate level, high school golfers as well. So really kind of hitting that wide spectrum of skill levels, and seeing what areas would be most beneficial from a movement standpoint. Because at the end of the day, I'm not a golf coach, right? So we got to kind of stay in our lane, saying where our expertise is. But the good thing is, as you well know, is having a good team around you, right? So a good network of professionals in whatever specific area you're looking at. And so in the golf world, there's all sorts of professionals. You have the strength conditioning coaches, physical therapists, chiropractors, and definitely the golf coaches as well. And each provides their own unique skill set to help that athlete, help that individual with whatever their goals may be.
Yeah, definitely. That's awesome. And, I like the term avid because I don't feel like you have to necessarily be a professional in order to be able to help someone with their sport, in the sense that, I don't need to have played Barclays Premier League soccer in order to help a soccer player, just like you don't need to go on the PGA Tour to have an amazing impact on a golfer. And at the end of the day, the sports are about recreation and enjoyment. And yes, there's some competition. There could be some, competitive elements, and certainly a career if you are a professional. But I think most people would fall under the recreational side of things with sports like golf. And I like how you bring up the importance of the mechanics as well. And that's something I want to kind of dive into here to start, because the golf swing is kind of unique for someone such as myself, who is rather terrible at golf, for lack of a better way to put it, and grew up playing baseball. The golf swing just feels weird and awkward, and I can't really get it down. So for people like me, walk me through the mechanics of what you would normally see with a golf swing.
Oh, Dan, it's so easy. All you have to do is do your baseball swing. Just bend more at the hips. You got it. It's easy. No, there's I'm just kidding. There's a lot more that goes into it, right? And so, similar mechanics in a baseball swing and a golf swing. The fact that the biggest driver of movement, the biggest driver of power, is going to be coming from the hips, and really that ability to disassociate. So you'll probably hear that term a lot. Disassociate the upper torso from the lower torso, meaning your thoracic spine, lumbar spine, and then your pelvis as well. Are you able to turn and twist around that structure and create that energy that you need, and transition of energy throughout those segments to create power? Okay. And really that's the power creation. As far as the golf swing, I think most people struggle with the consistency of ball striking, right? So what is the perfect golf swing, right? Who the heck knows? There are so many different golf swings and characteristics. You can have all these professional golfers, amateur golfers, scratch. They're all going to have slightly different golf swings, right? And some people may have classified certain characteristics as golf faults, right? Oh, they have early extension, or they sway, whatever terminology you may use, but they call them golf faults. Well, we kind of classify more as golf swing characteristics, right? It's just describing maybe areas of their golf swing and what they look like. So despite the various swing styles amongst pro golfers, various movement studies have found that there is consistency across the board as far as sequencing of movement of the body. And so there's 4 different areas that they're looking at in that sequence of the backswing into the downswing. So backswing, we're starting at addressing the ball. From there, when you go into your backswing, the first thing that's going to move is going to be the shaft of the club. Next is going to be your lead arm. So you would imagine that those 2 things are going to move at the same time. Your arm is connected to the shaft of the club. Well, there is a small enough, enough of a difference, milliseconds essentially difference in when those move. From there, the next segment of your body that's going to move is going to be your thorax, your upper torso, your thoracic spine. From there, the last piece of the puzzle that's going to rotate is going to be your pelvis. So as far as sequencing goes, that's ideal in the backswing. Again, across the board, pro golfers, you're not going to see really any deviation from that order of sequence. Their hips are not going to move first. Your thoracic spine is not going to move before the shaft of the club moves. It's going to be shaft of the club, their lead arm, their thorax, and then their pelvis. Once they get to the height of the backswing, that's where the transition phase is. So you're transitioning from the backswing. You're storing all that kinetic energy in the backswing, and now you have to transition that energy into the downswing to make impact on the ball. So from there, it is the complete opposite as far as what sequencing happens. So now the first thing that's going to move is going to be your pelvis. So the rotation through the pelvis is going to start, and then energy is going to travel up through the thoracic spine, and then your lead arm is going to start coming down towards the ground, and the shaft of the club is going to be the last thing that is going to start rotating down, where all that energy that's been stored up is now transferring to that shaft of the club down into impact. So again, throughout that entire phase of sequencing, less than half a second, right? On downswings, real quick. And there's a lot of different swing characteristics that can happen, right? In that transition and the downswing. But at the end of the day, what is consistent is those are the four areas that move in that very specific order at the elite level golf skill set.
That's interesting. Yeah. And I like how you mentioned the elements all the way up from pelvic and hip rotation all the way up into the shoulder and ultimately the end of the golf club. Now, is there any specific component of the golf swing that you typically see, for lack of a better way to put it, dysfunction in? So is there a certain component of that you see, maybe loss of motion, loss of strength, or just pain associated with that specific piece?
Oh, absolutely. Pelvic rotation. And again, more specifically, that ability to disassociate the upper torso from the lower torso. So I said before, you're probably going to hear that a few times, that ability to disassociate. That's so important when it comes to that golf swing. That's where you're going to be able to develop power, right, in that swing. So that what's going on there? That could be a number of things, right? That could just be a motor control. They may have the range of motion. You put them on their side and have them do an open book stretch where they're rotating through their thoracic spine. Their lumbar spine is relatively quiet, if you will, so they are able to rotate through their spine. But once you get them in an athletic position or even a golf swing, they look stiff, but they're not really stiff. It's more of a motor control issue where, okay, now we want to work on the ability for you to understand what it feels like to be able to make that rotation, make that difference between the upper and lower body. So that's one of the more common things I see on probably just your maybe weekend golfer, your casual golfer. Certainly older population there, we may actually get more into actual true stiffness of the joints themselves, right? And so as we age, with maybe some arthritic changes that may be limiting some range of motion, but at the end of the day, my programming is not going to shy away from that. We want to try and get as much of that range of motion as we can, strengthen through as much of that range of motion as we can as well. But yeah, if you're asking, one of the more common things I see is probably, again, that ability to disassociate that upper body from the lower body, whether that be from motor control, proprioception standpoint, or true lack of mobility, whether that is in the lumbar spine or even the hip. So for example, your lead hip, say you're a right-handed golfer, so your left leg is going to be your lead leg. When you are rotating down through impact and through your follow through, you need a good amount of hip internal rotation at that point. A lot of males specifically don't have great hip internal rotation. So that would be something where we may determine with a golf coach. It's like, hey, maybe we don't have that physical ability to make that hip rotation. So one of the real common treatments for that, if you will, just from a golf coach is, hey, you're just going to, on your stance leg, you're going to rotate your foot down the range, right? You're just going to add a little bit of external rotation. That way you don't have to rotate over that hip quite as much. So yes, the hip is definitely the biggest focus, I would say, in the majority of the demographics that I see.
Interesting. And you mentioned both from a mobility, stability, and motor control standpoint with the hip there. So one, making sure you have enough rotation or transverse plane movement, but also strengthen that plane, especially with the glute firing, because your glutes are going to be essential for internal and external rotation of the hip. And then the motor control piece, as you mentioned, having the ability to engage and fire those muscles when we need to. And the motor control piece is always an interesting one to me because, people will tell someone, oh, well, your glutes just aren't working. And it's like, they work. It's just they're not necessarily working in the manner that we want them to for whatever reason. So it's always interesting when that topic comes up. And I also think it's interesting that we talk about these things in a physical therapy sense, which most people typically associate with pain or discomfort, when in reality, addressing these things might, I would assume, take a few strokes off your golf swing, hopefully, or help you hit the ball farther, if nothing else.
Well, definitely your distance is going to come from the hip drive. Absolutely. And that's if you're lacking in efficiency there, you could gain a lot of yards there. Now, gaining yards may not necessarily take strokes off your game, depending on how your short game and putting is, right? So, but if you're looking for distance, certainly, good. Again, going back to that sequencing of the shaft, the lead arm, thorax, and the pelvic rotation, building up, storing that kinetic energy, and transferring that kinetic energy throughout impact. And then you can dive into the weeds about attack angle, right? And so that's actually the angle that your club is hitting the golf ball at impact. So whether that is an iron or a driver, that's gonna change. Irons typically you're gonna have a more negative attack angle because you're going to create that divot, get underneath it, maybe create a little bit of spin. With the driver, you're going to have closer to 0 degree attack angle, which is going to create more lift. And that's how a lot of LPGA players, a lot of the women golfers, will create more distance. Is that going after that attack angle? Now, again, that's something that I don't measure. Leave that with the golf coaches, but that's something that I have learned from them, and is kind of a coaching tip or technique to maybe create a little bit more distance. If hey, they're in the gym, they're squatting this much, deadlifting this much, like we know they can create a lot of power, and that's kind of one of the cool things about golf, modern golf, really. Modern golf game now is you see people that are top of the leaderboard now. They're lifting heavy. They're lifting heavy weight. Tiger Woods, he's the one that kind of changed all that. No one was really doing much back in the 90s, right? Nobody's doing much strength training when it comes to golf. He came in and look what he did to the game, right? Now the same principles apply. A lot of the players, Scottie Scheffler, right? Last year Masters winner, won a bunch of tournaments, and he was squatting, deadlifting heavy weight in season. So this is an off season. This is during the season, making sure that he maintained that ability and that power and that efficiency of that hip drive, just like you're saying, because again, the glutes are going to create that rotation and create that extension through impact that they need for, yes, distance off the tee, but then also say, you're on a long par 5, that second shot, you need some distance on that as well.
Yeah, definitely. And kind of like you mentioned there, it is a combination of having strength and stability and just overall skill of the golfer to improve your score. But again, me, the golfer who has, usually gone out once a year for the past couple of years. I just want to hit the ball hard and far. So the strength element is certainly exciting. Now, as we mentioned, that kind of shifts to the performance side. Coming back to the PT side and, why someone might seek you out in the first place. You mentioned a little bit about that lumbopelvic hip complex pain and dysfunction already in talking about the swing, but are there any other injuries that you typically see golfers presenting with, and, what might those be?
Certainly. Shoulder, whether it's rotator cuff tendinopathy, some individuals, maybe in older age, rotator cuff tears, even biceps tendonitis, pec tendonitis. We'll even see elbow issues as well, right? And so you heard of tennis elbow and you heard of golfer's elbow, right? And so that goes back to, okay, what is the mechanism of injury? With tennis elbow, a lot of backswinging, working the muscles on the lateral side of the elbow. With golfer's elbow, where's a lot of the force being directed at impact on the elbow? It's on the inside of that, not the lead arm, but the trail arm. Okay, and the trail arm is the one that's going to create a lot of force. Now, we'll see that maybe if someone maybe that sequencing is off, right? And maybe they are they're not leading with their hips, maybe they're leading with their arm. They're much more arm dominant movement. We can also get a swing characteristic called chicken winging, where they may not have a whole lot of pelvic rotation, and so they're really swinging through with their arms, and to get around and create rotation, they'll chicken wing with their lead arm. Now, with their lead, when they do that with their lead arm, that can actually create, interestingly enough, tennis elbow on that lead arm, because most of the force now, that repetitive force, is going to be on the lateral side of that lead arm. But more often than not, it's going to be that golfer's elbow is going to be more on the medial side of that trail arm, because again, if you come in and impact, that's where most of that force is going to happen, especially if hey, maybe we're chunking the ball, right? That happens. I do that, right? Yeah, the inside of my elbow might be a little sore if I take a huge big divot and the ball only travels 50 yards or maybe less. So elbow is certainly a common area. Another one being shoulder, especially if there's limited shoulder mobility. I always am looking at thoracic extension with that as well. So yes, we need thoracic rotation, but the extension is going to help with shoulder mobility as well, especially into external rotation and horizontal abduction. So across the body, right? You're going to need to come across the body on that lead arm, and that trail arm, you're going to need a good amount of external rotation. So one thing that I'll do with people is, it's called 90-90 test. We get kind of an athletic stance, maybe up like you have your 5-iron, you're dressing the ball, and just hinge at the waist. Now bring your arms up to shoulder height, and now I want you to rotate back. Is there a big difference between the two? Right? And if say their trail arm, their back arm, maybe a little bit more limited in that external rotation, that's certainly an area that we're going to focus in on if they're having some shoulder issues, and create a little bit more of that mobility throughout the golf swing.
I like that a lot. And I love how you bring up the thoracic spine there, Noel, because, from a regional interdependence standpoint, the thoracic spine, especially the extension, as you mentioned, plays such an essential role in our shoulder girdle function. I think so many people forget that, the scapula is a direct formation of half of the shoulder, and all of those muscles that control the scapula come right from that mid-back thoracic spine type area. And for modern individuals, or modern lifestyle, we'll say, so many people spend their lives sitting down 7, 8, 9 hours a day. And as a result, things just tend to tighten up over time. And, I'm still young, thankfully, but I would imagine the older you get, the worse that becomes, for lack of a better way to put it. And I also love how you touched on the shoulder and elbow piece as well. And I didn't realize that you could actually develop a tennis elbow type presentation on one and a golfer's elbow type presentation on the other. That's interesting. And it made me think a lot about a long time ago, maybe 2 years ago. We did a podcast with former MLB pitcher Joel Bennett, and he kept talking about the importance of the glove hand in pitching mechanics. And I would say the same is probably true for the golf swing, is that lead hand is just as important as that backhand in the swing motion. And typically in baseball or in pitchers, we give all the attention to the throwing hand. And I would imagine in golf, the backhand is the one that gets more of the attention than the lead hand. Additionally, I think it's interesting how you brought up the rotator cuff and shoulder piece, because when I think golfer, I don't always think 18, 20-year-old, young, healthy, fit, active individual. I think of a sport that can be enjoyed across the lifespan, which is a great thing. However, after about, age 40 or so, males especially start to lose vascularity in their rotator cuff, and it increases the risk or susceptibility to degenerative type tearing or tendon type things of the rotator cuff, and that plays a essential role in our ability to use our shoulders, from everything from lifting up overhead all the way up to rotating as you would in a golf swing. So say you have someone that you're working with who presents with one of those types of pathologies, what kind of things are you looking to do to help them return to golf and be able to swing somewhat comfortably? Or is it not possible to get back to golf if someone has, a partial or full thickness rotator cuff tear?
It's a very difficult thing, can be a very difficult thing for someone who's presenting with significant, maybe functional decline due to rotator cuff tearing. We know now that individuals can have rotator cuff tears. It's been shown on MRIs and have no symptoms. So we know that people can live with these things, just the extent of maybe the thickness of that tear, but more importantly, how is it affecting their quality of life? And so that's really the biggest driving factor there in regards to, are they able to manage and are they able to continue with the activity of golf with, say, if we want to stick with rotator cuff tear. So those are factors that we look at. If they're going non-surgical route, right? So they're going non-surgical route. Maybe it's a smaller thickness tear, something that we want to continue to be as active as possible, enjoy the things they want to enjoy, but we don't want to create more issues down the road. And so biggest thing you mentioned before, so that scapulothoracic component, hitting all those muscles that attach around the shoulder blade into the thoracic spine, making sure they're coordinating well with each other with normal overhead movements. Making sure our mobility, not just in external rotation, but all the different motions. So overhead, behind the back, internal rotation, making sure we have good mobility there, but then also stability. Can you get there? Can I get you there? But can you get there yourself? Say with overhead squat, just with a PVC pipe. Can you hold that position? You start to come forward. If we start to maybe lean forward, you can't actually hold that position. Okay, is it a scapular stabilization issue? Is it a thoracic mobility issue? You keep going down the chain. Is it a hip mobility issue? Is it an ankle mobility issue that's causing an issue with the squat position as well? And so really looking at that entire chain is something that we go through with our screening exam. As far as the treatment goes, throwers 10 is always a good go-to, right? Throwers 10 developed for those overhead athletes. You mentioned working with MLB pitcher, and I'm sure any sort of variation there is helpful to engage those scapular muscles and the rotator cuff muscles. But for any sort of repetitive injury, which rotator cuff certainly can be in an older population, it's managing load, right? And that's really, a lot of what physical therapy is managing load management. So we'll really want to dive into, okay, how many swings you're doing in a week, right? Are you going to the range and are you turning through, 3 buckets of balls, right? And then, no wonder your shoulder's going to be a little sore. Let's maybe bring that back a little bit. Let's maybe do shorter clubs, right? And so versus just, cranking out on the driver or 5-iron, let's bring it down to maybe a 9 and limiting how many actual swings that they are doing in a week time frame. And a lot of times, having that conversation and being able to maybe bring them back a little bit if they're doing a little bit too much is okay. We can not overstress and create those repetitive issues in that shoulder, and a lot of times we can manage that way. Otherwise, for rotator cuff tear, again, that's one of the things that is definitely difficult if it's maybe close to full thickness. We're thinking this may be a surgical candidate. Those are conversations we want to have, and certainly I've had plenty of clients and patients that have returned back into golf after rotator cuff surgery. Can certainly be a long road, but the good thing is there's a short game you can always work on in those early months of rehab, right? And so so we're out of the sling, we're just getting into strengthening phase, maybe 6-8 weeks out. Okay, go putt. You can go putt. That's fine. You can still work on your short game, and then gradually get back into working on chipping, right? Adding chipping, and then back into that load management of really what I call it, kind of a return to golf, progression essentially, right? And so there's return to pitching progressions I'm sure you're familiar with. Same thing with golfing as well. So lots of ways to manage that, and we really want to look at it long term and what that total stress, total load is maybe in a week.
I love that concept of load management, and that's something that I keep hearing come up in podcasts that we do over and over again. Matt Boyd mentioned it with lacrosse athletes. Blair O'Donovan mentioned it with basketball athletes, and so on. A lot of younger individuals, I think, are feeling pressure to do more in order to become the best version of themselves. And a lot of older individuals are feeling pressure to do more because they want to stay active and they want to be able to do what they want to do. But unfortunately, the body has a point where if you do too much, it starts to get unhappy. You can't overload to the ends of the earth. There's a point where you overload too much. And that point is very different from individual to individual. And it can be very difficult to find that optimal load management zone, especially in the past, we've talked about sports like lacrosse, and how do you regulate, how many lacrosse shots an attacker takes per week? And I guess I'll ask you the same thing in regards to golf. How can you regulate how much golf someone does in a week? Do you regulate it more on the driving range side, or do you try and regulate how often people go to a golf course, or what's your optimal way of addressing load management in a golfer, I'll say?
Sure. So again, looking at the two ends of the spectrum on how often are they getting out there now. So you're going to have high school collegiate athletes that are at the range every day. Then they're going to have a tournament that weekend, and they can manage that load just fine, right? Until they can't. And so understanding where they've been at in the last 3-6 months, and if they're starting to have repetitive injuries creep up, okay, you need to have that history of where they're at and bounce back a little bit. Same thing with the maybe weekend golfer, a recreational golfer. Maybe he'll get out to the range right before a round of golf, and then plays 18. Who knows what their handicap is? Could be shooting over 100 shots on 18 holes, maybe under 90. You ask them what they're shooting. Some people will maybe lie to you about what their handicap is, right? Maybe they're not as honest about how many swings they're taking out on the golf course. So just having those conversations about where they're typically at in a week, but then also look back the last 3-6 months if we're starting to have some of these issues. So again, the person that has really picked it up, a really drastic increase in golf. So someone, hey, I'm going out to the range, twice a week, and I'm getting out to course maybe once every other weekend, right? Just in the last month, and I'm really having some shoulder issues. Okay, well, what were you doing the previous month? You did that in the last 4 weeks. What were you doing the previous month, previous 2 months? Well, nothing. I just kind of went to the range twice a week and then getting out. So really have to have those conversations about where they've been at in the last few months to kind of gauge where that load is at and make those adjustments from there.
Yeah, I like that. And that allows it to be a very individualized approach. Now, as we've been talking too, I realize we've talked a lot about movement and we've talked a lot about, various exercises you threw out the Throwers 10 program. We didn't really talk much on the manual therapy element yet. And is that something that you bring into the golf population? Do you like to do various soft tissue techniques or joint mobilization manipulation? And if so, is there anything that you typically reach for when working with a golf athlete to help improve swing or decrease pain or the like?
Absolutely. Any manual therapy, hands-on treatment, or even say foam rolling, trigger point release, my message is always the same: is, hey, all these things can be are temporary. We know this, but they're here to support the movement, right? If there's anything that can make the movement exercise more tolerable, maybe more effective, then I'm for it. And so as far as the manual therapy side goes, do a lot of manipulations, right? A lot of high velocity, low amplitude manipulations for the lumbar spine, the thoracic spine, and even the neck as well. And that's one area I don't know if we've talked much about is having a good amount of cervical neck rotation, right? And so if we're lacking in cervical rotation, whether it be joint stiffness, previous surgical history, whatever it is, that could be an issue that may be causing some pain in the neck or the thoracic spine as well. And so we know that joint manipulation and mobilization actually are very effective when it comes to spine pain itself. That with movement afterwards, because now we have a reduction of pain with a particular movement. Let's use that to our advantage. We're going to move into that movement and try and gain more mobility if that's our goal, more strength if that's our goal, maybe balance, right? You touched on balance earlier, certainly an important part of the golf swing itself. And so manual therapy is certainly something that I use a lot of, especially in the golf population. They tend to respond very well to it in the higher skill level, high school, collegiate, even amateur. That little edge, that's going to help you out. If it gives you just a little bit of maybe confidence in your movement, why not? So the joint manipulations, especially along the lumbar spine, thoracic spine, and cervical spine, probably the most common ones I do. Dry needling as well. Let's say maybe someone's developing some rotator cuff, maybe some lat tightness, and we've been doing a lot of trigger point release, maybe some resisted strengthening to maybe gain a little bit more mobility, but we're not quite getting there. So maybe a little more aggressive form of those treatments could be dry needling. So I'm certified in doing that as well. I found that to actually be pretty effective if we're dealing with maybe some myofascial pain that's limiting maybe the last little bit of mobility. So certainly an area that I use from the physical therapy standpoint side of it, with the goal of supporting the long-term goal of whether it is that mobility, strength, or balance that we're trying to achieve.
Yeah, I like how you bring that all together, and it kind of combines a joint-focused approach and a soft tissue-focused approach, which I think ultimately is the way to go at the end of the day. Unfortunately, I'm not dry needling certified myself, and I also don't work with a ton of golfers, believe it or not. But I find a lot of benefits through myofascial cupping, especially pairing that with movement. And I also like a lot of I-stim techniques. I'm also a big proponent of Dr. Kyle Bowling's CTM band. Shout out to Kyle, because having a tool that allows me to pair the deep trigger point type release, like deep pressure, with mobility, stretching, movement-based things has been very valuable to us in the clinic. And, I like the realm of manual therapy because there's so many tools in the toolbox, right? There's many ways to skin a cat after all. And as you mentioned, those are phenomenal interventions that can achieve those goals. And, you mentioned the spine manipulation quite a bit. And that's one that I really like because you get so much benefit in such a quick time. You don't have to sit there and crush 20 to 30 minutes of thoracic extension mobility when you can just do a PA manipulation in whatever position you'd like and have someone, kind of reinforce it with some exercises and good to go.
Yeah, I agree. Yeah, very very similar approach and philosophy. It sounds like is again with athletes. It's that efficiency of their movement. How can we improve that efficiency? Again, I touched on earlier, right? Mindset is a huge part of the golf game as well, especially at any level, really, at any level, no matter what, having that mindset. And again, if something can give you maybe a little bit more confidence in maybe not your swing, but maybe how you're moving through your swing, and you're not as worried about, oh, I'm going to have this back pain when I'm done, or I'm going to have this shoulder pain when I'm done. I'm not as worried about that because I feel I've been getting better. I've been feeling better. So if we can add confidence with that, that helps with that mindset side of it. That's going to help with our overall functional goals as well.
I completely agree. I've got to ask the question now, Noel. Does equipment matter at all when it comes to golf swing, mechanics, pain? Is there ever a time when maybe someone just needs to get their club regripped or maybe just get a new club? Does the equipment that someone uses in golf really make much of a difference or not particularly?
Well, of course, Dan, it's always the club's fault, right? Yeah. And so you're playing bad, you get a new driver, and then you hit great, right? Maybe for 2 weeks, and then you're back to the old habits. So, for me, not really, but to dive in that a little bit, common piece of equipment that people will change is the stiffness of their club. So, for example, if someone has a really fast club head speed, so they swing very very fast, but they cannot quite catch up with their hips, and they have a more flexible shaft. They might be more might be helpful to get a stiffer shaft. That way there's less bending through there, and so you have maybe a little bit more consistency upon impact. You mentioned grips. Yeah, certainly after a while, your grips are going to go just like any sport. So regripping there just so you can maintain control of that shaft and of that club head certainly is going to be important. Most golfers, if they're out enough, you're going to blow through golf gloves, maybe a few times a year, maybe a few times a month, depending on how often you're getting out and what type of gloves you're getting. So certainly equipment, does play a role. There's all sorts of different golf balls that you can get as far as how soft the interior is. I'm not going to pretend that I know enough about all that to dive into that, but it definitely does play a huge role on again that higher skill level. And even on the recreational golfer, going back to maybe that shaft stiffness can definitely make a huge impact depending on, okay, how are they moving? Are they swinging too fast or are they swinging too slow? And changing that stiffness can certainly help. So yeah, equipment does definitely play a role in that, and that's something I really rely on all the golf coaches that I'll contact and work with and pick their brain about that. They're kind of the experts when it comes to that. And so really kind of rely on their expertise there. So, but yeah, like I said, I don't think I'm good enough, for my golf swing, my golf game to say it's the equipment's fault, not user error most of the time.
I was gonna say, do we ask what your handicap is or what golf clubs you prefer to swing? Or...
Yeah, well, I've been let's say I bought a hybrid. I bought a hybrid recently, last 6 months, and was not hitting too great with it. So borrowed a buddy's hybrid and different brand, but funny enough, I hit that thing way more consistently than the one that I bought. So sure, we'll go with, yeah, it's definitely the club, right?
Definitely, definitely. Noel, this has been a great episode talking on so many different key pieces of golf from both a physical therapy and performance lens, referring to lumbopelvic hip complex dissociation, discussing a bit about the shoulder and the shoulder's role in golf. We touched a little bit on the elbow and pain that can kind of come about from the golf swing and the elbow. We touched on manual therapy techniques. We covered a lot of different things. Do you have any kind of closing thoughts or closing remarks or anything that we might have missed that you want to dive in deeper on?
No, I like talking about this stuff. I enjoy it. There's a large following in golf. It's getting much more popular nowadays. Very popular. Yeah, I don't know if I mentioned I'm in the Jacksonville area, so Players Championship is coming up here. We're recording this on Wednesday, February 9th. So Players Championship's coming up in a month here. So there's a buzz going around. So it's a good time. And at the end of the day, I think most of us got into the world of physical therapy because we wanted to help people continue to do the things that they enjoy doing. At the end of the day, that's what I'm trying to do. Whether that's your weekend golfer, the guy, someone that gets out once a month, once a year, wherever they may be. If that's something that you enjoy doing, I want to keep you doing it. And so, if you got any more questions, feel free to reach out. I'm sure I'll give my information out at the end if you don't mind, Dan. And like I said, reach out, and if there are any questions regarding golf in general, golf, physical therapy, performance, all that stuff, I'd love to continue conversation going with anybody that's interested.
Definitely, yeah. So for people who are interested and they want to reach out, where can they find you at? Are you on social media, website? Are you still stuck in the MySpace generation?
Let me ask, did you ever have MySpace? Are you old enough for that?
When I was in third grade, I had a slightly, I don't know if I would say illegal, but I did have a MySpace page, I guess you could call it, slightly before I probably should have.
I'm sure my page is out there somewhere if those servers are still active. No, mostly engaged with social media, mainly Facebook, more so Instagram actually. And so my practice is called Driven Physical Therapy. Pun is definitely intended on that one. So driven.physicaltherapy is where you can find me in my business account. That's where I do most of my communication. Again, my client list is relatively small, but intentionally relatively small. So a lot of it's kind of word of mouth. But I like to stay engaged on social media and have some educational information out there, diving into a little bit of things that I give out to clients to help manage maybe some of the issues that they're having. So again, Facebook, you can find me at Driven Physical Therapy, or Instagram, driven.physicaltherapy.
Yeah, that's awesome. We will link to all of that below in the description. So if you didn't quite catch it, you can just click there and check out everything that Noel's doing over with Driven Physical Therapy. Noel, always a pleasure. Thank you again for your time.
Dan, thank you so much.
Thank you so much for listening to this episode of the Brawn Body Health and Fitness Podcast. If you liked this episode, please make sure to share it with a friend, subscribe so you don't miss any of our upcoming episodes, and leave a review. This way we can spread knowledge and motivation and help reach more people. Thank you again for listening, and I'll see you next time.